Well, I can't say that it would be a greater issue because I think mental health is represented throughout our population, whether you live in a rural or an urban area. But I think what really differentiates having a mental health illness in a small community is that it may be much more difficult to get a diagnosis. There may be stigma attached to the diagnosis. It may be harder to find care for yourself or access care because it may not be present in your community. And there may be cultural barriers as well in terms of accessing service. So I think that, I can't say we have a higher percentage of mental health issues, but I think mental health is hugely important and unfortunately sometimes not always well served in rural BC. I think that's a wonderful myth because every community has its stress. A lot of people think, oh, get away from traffic jams and everything. But sometimes life, having lived in small communities, sometimes life in really small communities can actually be more intense because there may be interpersonal frictions or, small communities are often also very resource dependent. So if you look at sort of examples like Mackenzie, if the mill's shut down and all of a sudden half of the town has lost a job and has to go elsewhere to work. So I think small communities have unique stressors. Weather can be a stressor in terms of just travel in small communities. And sometimes there, as we touched on before, there's not as many resources available to people to handle stress. It's very difficult. Have you traveled some of our highways? It can be very difficult accessing things by road. Access is, part of it is road conditions or weather conditions. If you live on Haida Gwaii, you have to depend on a ferry which may or may not run, or you might be stuck 3 days on that ferry, which has happened to me. But it's also time. Like a lot of people have to work and it's very difficult for them if they have a specialist appointment in a larger center. They actually have to book off work or consider childcare or elder care if they're caring for aged parents. So it's not as easy. In the urban centers, I guess you have your challenges too, but a lot of times there are barriers for people. There is a service called the Northern Health Bus that will bring people for specialist appointments in Vancouver. But again, it's a time commitment and it doesn't work quite as well sometimes, like if people can't make that schedule work for them either. Absolutely, I think that's across the province. So I think, we're underserved throughout the province and I think we try our best to address that. But on many levels, yes, there is a higher need for service. Unfortunately, the answer is the same as to the first question. So no, we don't have comprehensive services. So if we look at comprehensive services, we would have grassroots services like support groups, sort of community level services. Then services that you can access through your family doctor's office. There's a program called Bounce Back in British Columbia, which can be delivered sort of through phone coaching. So that's sometimes a solution to difficulty with accessing service. But mental health clinicians are few and far between, especially in smaller communities. Psychiatric care can be delivered by either telehealth or driving. So I live in Prince George. We do an outreach clinic to Vanderhoof. But there are communities such as Fort St. James, which has not had that level of service and would really love to have that level of service. So access is really difficult and we try to address it through telehealth. There's a lot more online resources nowadays for people to use in terms of support groups in a chat group. There are sort of a lot of online resources, say for CBT, those kind of things. So we have to be a little bit more creative, I think, in how we use things. But unfortunately, we are dealing with a challenge in that we have a huge need and not a lot of resources, so we have to try and manage them wisely. That is really a problem, I think, throughout healthcare, unfortunately, because part of that also can be related to EMRs. We have a lot of different electronic medical records. So the electronic medical records are really helpful in terms of being environmentally friendly, hopefully providing platforms that everybody can access. But because we have different ones that are not always compatible with each other, sometimes a patient will go in to the hospital and they've had medications prescribed by their family doctor. Those medications then get changed, and when they're discharged, there isn't an immediate way necessarily for the family doctor then to be in the loop in terms of, oh, unless the patient can come in and say, okay, yeah, these are my new medications that I'm on. So sometimes there are gaps in our care in terms of just informational gaps. Then unfortunately, we also sometimes have gaps with linking people to services after discharging them from hospital, because those services are either under-resourced, so there's a long wait list to get people into those services. Sometimes it's hard to even discharge people from hospital because the services aren't in place to discharge them to. So we really want to provide the best care for people. In a sense, we'd like to have excellent preventative care. We'd like to have efficient and comprehensive care in hospital, and then have that continue when people are discharged so that everybody knows what's happening. But right now, unfortunately, I think that's still a work in progress. Well, I would say for myself, I am based in Prince George, and I am a family doctor who has had the opportunity to go back and do training in psychiatry, and I plan on staying in the north because I love it. So, so for me, there are a lot of wonderful things about living in the north, but I think it also takes a certain mentality to live in the north. So if you don't like cold weather, if you don't like snow, or if you really love things that are, urban amenities, then it may be sort of less attractive to you. Practice can be interesting everywhere, whether you're in an urban or a rural area. But I think it is sometimes challenging to retain people, especially if they come with different expectations and haven't had a rural background, they might struggle. Or sometimes the problem is their spouse may not be able to find work, or it may not be a satisfying move for their spouse or their family. So yes, it is actually a problem retaining people sometimes. Sometimes there's a revolving door of people that come in, and of course that's not ideal care, because it speaks to the question that you asked me about continuity of care, because really knowing people over time is very important for their benefit as well as for yours for working with them. Well, I think that, if we had an unlimited pot of money that we could dip into, I'm sure that we could resolve a lot of these issues, but we don't, and so we need to manage things wisely. I think there are a lot of amazing initiatives that are happening in terms of trying to deliver online mental health care. Grassroots initiatives are really important. I can certainly put in a plug for the Mood Disorders Association of BC, and having a lot of very innovative programs delivering group medical visits. And again, this is a concept where if somebody needs their medication managed, rather than having to wait a month to see a psychiatrist, they can come in for a weekly appointment. But it's slightly different because there are a group of people who come for their medications to be managed. So on the one hand, you might say, well, what about confidentiality? So there has to be an agreement for that. At the same time, having experienced that, I find that people really like the group setting. They learn from the other people that are there. There's some group support that is really important. And actually, if you're a consumer and you're taking a medication, you're probably going to trust the person who's been on it more about what they have to say than you might your own doctor. So I think that's a great initiative. I think preventative medicine is really important. And again, I think the exercise group that has been developed at the Mood Disorders Association is one of the things that speaks to that as well, in terms of people exercising together as a group for the purpose of group bonding, improving their mental and physical health. So I think these are initiatives that are helpful. Bounce Back, which is a program that targets mild depressive symptoms and is delivered to people via phone. It's a kind of phone coaching, I think is really, really helpful in terms of people feeling less isolated, being able to start to set goals for themselves. I think that preventative care is huge, and it would be lovely if we could incorporate that more in our schools, which I think the schools are also, I'm seeing changes in the curriculum. We have Head Start programs, we have more mindfulness-based programs that are starting to be delivered in the school curricula. So educating people, destigmatizing mental health. As far as resources, we need better connectivity with our EMRs. It would be wonderful to have a little bit more frontline input into some of the big mental health initiatives and restructuring that are occurring, because obviously our government has to manage money wisely and has good ideas for trying to do this, but sometimes I think frontline workers feel a little bit left out of that process of change as well. So I think it's up to all of us, in a sense, to be good advocates, to be cognizant that this is something that many, many people deal with at a different point in their life, and to continue to inform ourselves and to be the squeaky wheel sometimes to the powers that be, in a sense of talking about what we need. Yeah, so it's huge. So basically when the roads are icy and slushy and really dangerous, and many of our physicians have actually had accidents on the road going to clinics, telehealth is a way of delivering a sort of a service where you can do a consultation with someone, you can do follow-up appointments, so you're saving a little bit of driving time. It's not 100% the same as being in the same room, so it's not quite the same, but technology has improved so much that it's very close. So it's a wonderful way of being able to extend a resource. So rather than patients having to travel, which is also, you know, as we talked about, just time consuming for them, not always safe and hard to plan for, it's a way of delivering health, like, and not only in mental health, like in psychiatry, but for many different disciplines in medicine. So that is huge. The other thing I should mention is being a resident now in psychiatry, because I'm a family practice physician who has gone back to do a residency in psychiatry, and I'm now in my 4th year of that. Without sort of video conferencing capability, I wouldn't have this opportunity to live in my home community and still be educated. And I think this is huge in terms of potentially retention of physicians as well, is just having distance learning be a possibility, whether it's, you know, for a physician or whether it's for a mental health clinician, or, you know, so those things I think are really important. Well, I'd really sort of like to speak especially to youth and elders in small communities, because I think these are very marginalized populations, and I think youth especially, so whether they're dealing with depression, mood disorders, gender issues, substance use issues, I think, you know, it's really, really important for them to have good resources. And there are online resources for youth. There's the Kelty mental health program, which is a great resource for youth, and then for elders too, because seniors can be very marginalized if they're living on their own, if they don't have a lot of social contact. Sometimes their mental health can change really quickly, and people may not really notice it. So this would be sort of another area where hopefully we could just have more awareness around it.